Right, so thank you, Hezron Kimari, for that. So away from, politics in terms of clearing of candidates, let's talk about matters health before I bring in my colleague Duncan Haimba. And the 49th Kenya Medical Association Conference is currently underway in Eldoret in a bid to activate health systems change to improve physicians' well-being. Alvis Kosgei now joins us with more report from the county of Uasin Gishu. Kosgei, good morning. Kindly bring us up to date.
Thank you very much. We're coming to you from Noble. This is in the county of Uasin Gishu. And currently the annual conference of the Kenya Medical Association is underway, where physicians are drawn from different parts of the country, of course, are here for the 49th annual conference. This is in a bid or an aim just to better the healthcare and also the welfare of physicians. I'm not joined by the SG just to paint a picture of what we should expect today. I understand of the president, you're the SG here, the chairman. What more should we expect today?
Thank you very much. Kenya Medical Association is a membership association of all doctors and other health workers whose twin mission is to advocate for quality healthcare of all Kenyans and the welfare of its members. This particular conference is actually focusing on the welfare of its members. As you know, you cannot drink from an empty cup. So your healthcare provider must have mental well-being and physical well-being. And therefore this conference is focusing on how to detect mental health issues related to the physicians, as well as addressing issues like burnout and the factors that cause it.
What are some of the tough and innovative measures that you've put in place to ensure the mental health and well-being of doctors?
So the conference has actually identified several issues as causing mental issues in practicing physicians. The first thing is poor working conditions such as low staffing that causes issues of burnout. Areas of mentorship have been shown to help in relieving some of the problems that may be faced by physicians. So the Medical Association is a mentorship platform, and some of the mentorship programs that have been put in place for physicians are actually helping in improving the mental well-being of physicians so that they can be able to serve Kenyans very well.
I understand this is a voluntary body. How many cadres do we have here?
So there are two types of membership. The first type is you have the members who are the voting members, who are the doctors, but we also have associate members. The only difference between a full member and an associate member is that a member votes, a non-member does not vote, but is a member from the other cadres. So nurses, clinical officers are also members of the association, because health is a teamwork. The health people work together as one. So we have the primary membership, who are the doctors, and then we have associate memberships, who are the other health cadres.
Thank you very much. Let's also hear from you.
Yeah, Dr. Jakait Charles. I'm the chair of the Eldoret division, Kenya Medical Association. Well, my brief is that this conference to us is helping doctors, health workers very well. As you've heard, we have doctors from all over the country, and they are from different cadres, from the subspecialties to the general physicians, to those who are doing internship. And as the Secretary General has just said, the truth is that after the COVID-19 pandemic, we came to a realization that there is indeed a need to take care of the physician also. Trauma affected everybody. And that's why we are here to discuss among ourselves, how do we help ourselves best. Yes.
Let's also hear from the president of Kenya Medical Association.
Yeah, so we are here with Dr. Frank Jenga, who is a presidential advisor for mental health. We are also here with the new CEO for KEMSA, Dr. Terry Ramadhan. who we have baptized Daktari for today because she's in our conference. And we're here in the KMA conference, which is themed activating health system change to address the physician health issues. And we really want to address the mental health challenges that doctors face so that they can be able to provide better care to the public. In fact, today we are going to launch a very a good collaboration between the Chiromo group of hospitals. We're also going to launch a partnership with KEMSA and other partners in the pharma industry, and with the Kenya Psychiatric Association, which we need now, which we'll use to provide care to all doctors and healthcare professionals in this country, so that they can be better taken care of in terms of their mental health issues, so that they be good doctors to the public.
Okay. Yeah. Let's also hear from the CEO, KEMSA.
We're happy to be able to support the doctors in ensuring that the commodities that they require to get the health care that they need, as well as the other citizens, are available. So we will walk this journey together. As you know, we're in the middle of our reforms, but as you fly, you have to keep fixing your wings. So we will do what we need to do to get the commodities to where they need to be.
What are some of the challenges you've been experiencing, and also what are some of the tough and innovative measures that you've put in place to ensure that you harmonize this cooperation?
The challenges are many. First, I think one of the things that we've not been doing very well, as a health sector, is talking to each other. We talk at each other, and forums like this start to establish mechanisms for us to talk with each other. But the three most important things we as KEMSA are focusing on doing is ensuring that we will have operational excellence in all the measures and processes, systems within the institution. We will ensure that we are focusing on customer satisfaction, because we must touch those that we serve by being responsive to their needs. And third and most important, reposition KEMSA so it becomes an institution that we are all proud to be associated with, and not one that people want to run away from every time they mention.
Thank you very much. Lastly, let's hear from you.
Very, very good morning. This is a great day. It's a very, very, very important day for the government, and I speak today as a presidential advisor on mental health. It's a big day because recognition has been given to a very, very, very important subject, which is that a broken doctor is not a doctor. And by focusing on fixing our doctors, mainly in terms of preventing preventable conditions, anxiety, depression, post-traumatic stress disorders, and so on, and to see participation at this very high level of the entire Kenya Medical Association collaborating with the Kenya Psychiatric Association makes it a very, very happy day, because we fix our doctors, we can then fix our patients.
Thank you very much, sir.
Yeah, maybe international.
Okay, from the international perspective.
Well, from an international perspective, we must not forget that the doctor is not the only person in the healthcare team. And we mustn't forget the other healthcare professionals, the nurses, who are the backbone of delivery of care, and other professionals. We should also not forget that there's a lot of mental illness in the general public. So remember that these facilities that you create for taking care of the medical profession become the same platform for taking care of other healthcare professionals and the society. So people must not see it as just benefiting the medical profession. The problem of mental illness is at all levels of society. But more importantly, we should also look at the root causes of mental illness and ensure that the working environment is suitable, so that we stop mopping the floor, look for the leak and fix the leak, so that you have no water on the floor. So we must not forget the causative factors, and we look at an enabling working environment so that the mental health of healthcare professionals is assured and the well-being of the public is assured.
Thank you very much. From the County of Uasin Gishu, it's back to you, studio.
So we get to learn about some of the challenges doctors face, mental challenges they face as they treat Kenyans who are fighting, COVID-19 here in the country. It's been now over 2 years since the COVID-19 pandemic hit the world. Now, time for a short commercial break, but when we come back, I shall be delving into a conversation about clearance of candidates, presidential candidates, and other political aspirants who are eyeing various political seats. And on your screen, you can see my colleague Duncan Heimber here with me in the studio. We'll be talking to us about the political diary and also clearance of political, actually presidential candidates in at the Bomas of Kenya, where that exercise has been ongoing for the better part of this week. And it's expected to come to an end on Sunday when ODM party leaders, also Azimio flag bearer, running candidate, will be presenting his credentials for clearance. But then also, we shall be crossing over live to my colleague Clement Masombo. There you have it on your screen, ready to bring us up to date. Also, when it comes to clearance of candidates in Nyeri County. So, it is a conversation you don't want to miss. After the short commercial break I'm taking right now here on KTN News.